next speaker is Dr. Moline. Dr. Jacqueline Moline has also been laboring in the vineyards of asbestos-related work with some particularly special areas of interest, and we look forward to your presentation. Thank you.
Hi, good morning, everyone, and it's a real pleasure to be here. I'm going to talk about asbestos-related diseases and the importance of history. Asbestos-related cancers include laryngeal cancer, mesothelioma, ovarian cancer, and lung cancer after asbestos is breathed into the respiratory system. Mesothelioma trends, as we've been talking about with legacy asbestos, we see that there was a peak in around 1990 for mesothelioma among men, but in women it's actually been fairly steady to slightly increasing, and we can talk about some of those reasons in a moment. If we look at mesothelioma mortality rates, we see that they are highest in the Northeast, Northwest, and Midwest, and Louisiana is also in there because of shipyards. So we see in the areas where there is either mining or there are shipyards that much of the mesothelioma mortality is the highest in these areas. This isn't to say that mesothelioma doesn't occur throughout the United States. In women, mesothelioma is highest in areas where there were shipyards, and that's from take-home exposure, meaning that they lived with somebody who worked in asbestos shipyards, brought home the asbestos fibers, they shook out their clothes, they contaminated the household, the workers contaminated the households, and it led to the development of mesothelioma in women. When we look most recently in women, the three highest occupations for the number of mesothelioma deaths in 2020, this is from a report from the CDC in the mortality and morbidity weekly report that comes out, was homemakers, school teachers, and registered nurses. This is just what their occupations were. It doesn't talk about what their exposures were. So homemakers could have had it from living with someone who worked with asbestos. Same with teachers, same with nurses. Nurses could have had occupational exposure, and we'll get into how they could have had that occupational exposure. And teachers may have had it from their own use, not necessarily from the school, but their own personal use, which we'll talk about. So that's where we transition into talc, and by talc I mean talc contaminated with asbestos. So talc is used both in the industrial setting, it's used in rubber, plastic, ceramic, paint, and many other products, and it's also used in cosmetic products, such as talcum powder, face and body powders. Talc with asbestos is considered a possible carcinogen. Well, actually, it's considered a definite carcinogen, it's group 1. And then non-asbestiform talc is considered 2B. The use of cosmetic talc is reported as high as 50% in some countries. Now, an industrial talc mine in New York State, if we look, and there's a particular company, there's data from the talc mine workers for about 40 years. They found elevated rates of lung cancer. They found 2 deaths from mesothelioma. That was early on, and the authors concluded it was unlikely that mesothelioma cases were due to the talc ore dust because there was a short latency and there was a brief employment at the mine. But there were some issues with that data, and there were some issues with the numbers. Because when they looked, and they actually found, by 1986, there were actually 8 confirmed cases of mesothelioma, and the occupational exposure to dust from these talc mines led to excess mesothelioma cases. So the rate was actually 5 to 10 times what the background rate was from during that time frame. There were 5 new male cases, 3 new female cases, and there was an increase in talc exposure duration that was associated with more lung fiber burden for both fibrous and non-fibrous talc. There were asbestos bodies seen in individuals with more than 10 years exposure. There still were new cases that were identified as the years went on. There were 5 more cases. The incidence rate now was statistically significant, and it was 5 times what the general population was. Tremolite and anthophylite, the fibers of asbestos that are found coexisting with talc as it is mined, were seen in both the mine and mill dust, and they were also seen in the lungs of the talc workers. So the increased risk of mesothelioma was finally attributed to the inhalation of these fibers from the talc mining. In the United States, for non-industrial, but for cosmetic talc use, we look at the various different brands of talc that were used, and we can see the usage from various products in the United States were pretty prevalent. In some parts of the country, up to 80% of people use cosmetic talc, particularly in the more humid South. There's also differences between blacks and whites in terms of use of talcum powder. Now, women were discussed as having what's called idiopathic mesothelioma. And for occupation, less than 50% of women were found to have an occupation that associated them with malignant mesothelioma. They have had these home exposures from family members, and in studies there were limited categories of work. They weren't asking the right questions. They were limiting the questions, they were limiting the categories in which the researchers could categorize someone as actually having an exposure. As a result, they were categorized as having no exposure, when in fact they had exposure, they just weren't asking them the right questions. Other studies have shown that tremolite asbestos fibers were found in the lungs of women with malignant mesothelioma. They didn't have any asbestos contact that they knew of. What they did have was cosmetic talc use. The authors even stated, and this was decades ago, that cosmetic talc could be the reason for these findings, and these are the same types of asbestos fibers that are commonly seen in cosmetic talc. There were non-occupational exposures, but none of these papers, they're all silent on whether talc was used by any of the people. Now, how would a nurse occupationally be exposed to asbestos? Well, they powder patients. They use a lot of cosmetic talc when they are keeping patients comfortable, especially patients who may have incontinence. There's a lot of talcum powder that is being used. Years ago, talcum powder was used in gloves. No one remembers that. Now we have talc-free gloves, but they were used. People put talc into gloves in hairdressing as well, so as a way of getting it in, and it was used in a variety of different occupations. There have been a couple case series. I've had the opportunity to write one of them, and the goal of writing these case series for me was to alert physicians that talc was a potential exposure, asbestos exposure. I am really pleased to say that I will be seeing a patient this week who had a procedure where talc was used in their body and is concerned that it may cause a problem for him many years later. He's aware of it because he read the scientific literature and said, could this be an issue for me? So he's coming in. Hopefully his low-dose CT will be negative, but it's preventive, and it's because he had the information he needed. So these 2 case series, one was written by, I wrote with some colleagues, as well as Dr. Emery and Dr. Maddox. We had about 108 patients where we were unaware of any other asbestos exposure apart from talc who developed mesothelioma. There were similar trends in both the papers, predominantly female. There were more peritoneal cases than would be expected. Typically, peritoneal cases occur in about 10% of all mesotheliomas. Here we saw about 30% were seen in both of my paper and in Dr. Emery's paper. We found asbestos in lymph nodes of some of the patients, or some of the individuals in the paper, and it was the same types of asbestos that are found in cosmetic talc. Of interest, 7 of 108 were cosmetologists, hairdressers, or occurred in barbershops. Again, talcum powder is used in the occupation to clean off the neck. It's used by some folks when they're for the gloves and other things. People are unaware that they were diapered, but the diaperers and the diaperees have exposure to asbestos. There's perineal cosmetic talc use during the diapering. And individuals who use cosmetic talc diapering children, were diapered as children, did it as an occupation. Recall talcum powder being applied after bathing. Many years later, may develop mesothelioma. I've had individuals who were nurses who worked on the pediatric units where they used cosmetic talc, so they were occupationally exposed doing a task that they might also have been doing at home on their own children. And that visual, it's of the talcum powder, the cloud, using special lighting to see all the asbestos and the powder in the air. It's very easily aerosolized. I have a couple representative cases that I'd just like to go through, just to give you a sense of how this can be so insidious and how critical it is to come up with a good history. So a 62-year-old male computer programmer grew up in rural Pennsylvania, had worsening shortness of breath and a dry cough. He didn't have COVID. His shortness of breath worsened. He went, had an x-ray, and it showed white out of the lung, meaning he had a pleural effusion. He didn't, eventually the pathology showed malignant mesothelioma. He was treated with pleurectomy and immunotherapy. So he grew up in central PA. His family owned a farm that had vegetables and cattle. He didn't work on the farm equipment, so didn't have brake exposure. After attending college on a swimming scholarship, he began working in an office. His wife was a psychologist. They had no home renovations and didn't work on cars. His medical history was unremarkable, and there was no family history. He did have exposure to baby powder. His mom used it when she was changing his diapers and after a bath, and he was a swimmer. Swimmers use bathing powder on their swim caps. It's a way of both keeping the integrity of the swim caps and also getting it on their head. Much easier. And he used it all the time on his swim cap, and he also used it on his body, and he continued this practice for decades. Another case is a teacher who notes her clothes are beginning to fit her very tightly, even though she's dieting and losing several pounds. She goes to her doctor, who recommends a laxative. The abdominal distension got worse. She's found that she has ascites, which is fluid in the lungs. She finally gets testing done, and some atypical cells were seen. There's concern she might have ovarian cancer. She has a laparoscopy, a procedure to look into her abdomen, and it shows diffuse carcinomatosis, which is the finding we see with mesothelioma, as well as you can see that with metastatic ovarian cancer. The pathology showed malignant mesothelioma. She was referred to a specialty center where she underwent cytoreductive surgery with peritoneal chemotherapy. She does well for 3 years, then has a recurrence. So where's her exposure? She was a special ed teacher in a school built in 1992 after asbestos was no longer used in schools. Her husband was an office-based draftsman. Her father was a physics teacher. Her mother was a librarian. Her mom was a person who sold cosmetics on the side. From the age of 6, she used various talcum powders her mom would obtain. She used it until 2018 when she was diagnosed, and she also used but she used cornstarch on her kids when she changed their diapers. So really, just for future considerations, what I'd like everyone to think about is there's attention to true background rates for fiber burdens. We need to know what, when people are being pushed to do fiber burdens, what is the true background rate? We need to really obtain a history of all potential exposures. The swimming caps, for example, if you're not asking somebody what they did, what their habits were, what their hobbies were, you may not get to all their sources of asbestos exposure and recognize that talc use can be an asbestos exposure. So I thank you for the time, and I look forward to hearing from the other speakers today. Thank you.
Thank you, Dr. Moline. One of the papers that I read many years ago, apropos your patient who's coming in this week, was a young Navy sailor who had heart surgery in the 1940s. And they put talcum powder in the chest, which was commonly done in those days. 30 years later, got a meso. So that's even been, these case reports are in the literature.